Welcome to the Grand Rounds portion of the Neurology Diplomate program. The following slides will review some parameters for viewing the patient encounters under the Video Cases portion of the Neurology program. I'm your host, Joseph S. Ferrazzi, DC. Just a few things before we get started. Number one, the video cases are actually neurology consultations. These consultations were completely unrehearsed. These are spontaneous doctor-patient encounters, and the doctor and patient have never met before the class. The patients were invited into the neurology classroom by their treating physician. That treating physician would be a licensed chiropractor who was a participant of the Neurology Diplomate program. Before watching the patient video, you will view all of the medical records that were available prior to the consultation, as well as the patient admittance forms which were completed by the patient and you will see in the patient's own hand. The patient video is completely unedited. It will include the history and examination, and sometimes a report of findings discussion with the patient. The length of the video varies by case. The average is about 20 minutes, and the long ones are about 50 minutes. There are a couple that go over an hour. While watching the video, I ask that you please pay close attention to the doctor-patient encounter. Consider why certain questions were asked and other questions were not asked. Are these the same or similar questions that you would have asked this patient, and why? At approximately 10-minute intervals, the video will be interrupted and you'll be asked questions in regard to the patient encounter. Finally, I'd like you to keep in mind that the primary focus of this exercise is to examine the critical thinking process. Remember, this is an exercise in diagnosis. While it is always our goal as chiropractic neurologists and physicians in general to help people and help our patients, the purpose of this exercise is not only to determine what disease or dysfunction this particular patient may or may not have, but instead to examine the process of taking a history and performing an examination relative to arriving at an accurate diagnosis. Now, let's meet the patient.